Hi, welcome to your online module for your electrotherapy class today. Uh, as you know, we've talked a lot about electrical stimulation already. Last week we talked about ultrasound and how to use ultrasound with our patients in the clinic or wherever we might be working. Today we're going to talk about how we can use laser and the therapeutic effects of laser with our clientele and which kind of patients it would be most suited to. Um, the first thing, gosh. So these are some little examples of laser, and you can see that this photo here, that is actually an elbow, in case it's difficult to see what it is. So, and this looks actually like the laser probe that we have here at Dawson. Here you see somebody else being treated for their back, and this is a larger electrode, and a larger laser probe, and we'll talk about that a little bit. And here, this isn't just these guys being cool, these are not regular sunglasses, and you'll find out exactly why we would put those on. All right? So the first thing to know about laser is, what is laser? So laser is actually an acronym, and laser stands for light amplification for stimulated emission of radiation. And that will make a lot more sense when we talk about what it is and what it does. And that's going to be important for understanding that and being able to explain it to our patients. Now, we've all seen lasers. You see it in the movies where laser is being used to cut open the door of a safe, or it's being used in some supervillains are trying to use it to cut off different parts of the hero. We also see it, just in laser pointers, or the lasers that we use to play with our cats. So they're all different types of lasers, and there are actually 5 categories. Category 3 and 4 can be used medically. So class 4 lasers are used for surgery, either to make small incisions or to cauterize wounds. Class 3B lasers are the ones that we're going to be using for rehab purposes. Okay, and what makes them class 3B lasers? The important part is that they have a certain power. So we know that power is measured in watts, that's joules per second. And so the types that we're going to use are between 5 and 500 milliwatts in strength, in their power. So it's safe for skin. We don't have to wear protective clothing for it, but what it can pose a danger is if that laser beam is focused in the eye, that beam of energy gets into the eye, then it can do damage to the retina. And that's why both the patient and the therapist must wear protective eyewear. And what we also recommend is that it's either done in a closed room or that in some other enclosing. So here at Dawson, we're going to do it behind the curtains. And that just makes sure that the beam of energy doesn't escape from the area where we're going and inadvertently go into somebody else's eye. All right, so then it's important that you know kind of what are the different components of the laser. Okay, so a laser device is made up of 2 parts. There's a console that's delivering the energy to the probe, and there are different types of probe. What you saw before was examples of different types. What we have at the college here is a single probe, so there's one diode, and we'll find out what a diode is. Okay, and we use those single probes to deliver a small dosage over a smaller area. If you're in a clinic that has a cluster probe, that can be used to treat a larger area. And what it is, it's a group of diodes. Those diodes, they're not necessarily all of the same type. They can have different types of phototherapy, such as laser emitting diodes for a different type of therapy that can be combined. Okay, and we see examples of that here. So this cluster probe, we see has 1, 2, 3, 4, 5 diodes. These would be the laser diodes, and these 1, 2, 3, 4 would be light emitting diodes that would be used for different wavelengths, and we'll see what that means after. And this is an example of a single probe. So there's just the one opening, the one aperture for the laser coming out on this side. Okay, in order to understand how lasers work, we're going to talk about 3 key elements. So the first is going to be the fundamental properties of light. So what is light? The physical components of a laser, and then the process by which laser light is emitted. Okay, So if we look about what is light, so light is part of the electromagnetic spectrum. And you know this from your physics last year, right? So we know that there are all different, depending on the frequency, there are all different types of electromagnetic energy. What we see here is very small area becomes visible light. And then before that, so if there's a greater wavelength of the light wave, we call that infrared light. And if there's smaller wavelengths, that's ultraviolet. Where laser therapy sits on that is going to be between about 630 nanometers of wavelength and 904. All right, so we have your visible light here in this range between 750 and 400 nanometers. And most of the laser that we're going to use is going to be either in infrared, or some of the lasers that you may see on older models might be in the visible red spectrum. So the fundamental properties of light that are important for therapeutic uses, there are three of them. Okay, the first one is monochromaticity. So monochromatic, what does that mean? It means that all the all the photons that are being emitted by the laser have one single wavelength, and that means that it's all the same color. So monochromatic, one color, and it's one color because all the photons are of the same wavelength. And what that means is we can target specific receptors in the tissues that we're trying to treat. And those receptors are photoreceptor molecules that are sensitive to that specific wavelength that we're using. Okay. The next property of light that is important is collimation. And that is the ability of the laser not to diverge or spread. So it travels in a straight line, everything together. And that's what we use to precisely target a small area. And coherence is another property of light, of laser light, that's important. And that's just meaning that all the photons are traveling in the same direction at the same time. So a regular light source you would see has light that's going to spread and diverge, whereas laser light, we can see it's going to be focused. Okay, and it's all going to be the same color. Often a regular light source will have white light, which, as you know, is all the different colors together. Okay, so the physical components of a laser, there are three main components. It's the active medium, the resonance chamber, and the power source. Okay, and there are two types of lasers that are usually used for therapy. One is a gaseous laser, and that's a helium neon. We don't see those as much anymore. They were more used in the older types, and those would be the red in that visible spectrum, the red lasers that you used to see. What we see now mostly are diode lasers, so gallium arsenide or gallium aluminum arsenide, and those are the types that we have here at Dawson also. Okay, the main components of the laser may vary according to the type of laser. Okay, so the active medium is the material that's inside the laser, and that's the material that's used to emit the laser light. So we talked a little bit about helium neon. That was two different gases used to emit a certain type of laser. We won't talk about that as much because it's not used quite as much. But the gallium aluminum arsenide, those are the ones that are used in diode lasers, and those are more common now. And so what those are is that they use semiconductor material that's made up of different chemical elements such as gallium, aluminum, and arsenide, and those are used to create lasers of a certain wavelength. After the active medium, what we see is that there's a resonance chamber, and that's the cavity in the laser device that the active medium sits in. So the active medium is in this chamber, and that is activated and a laser beam is produced. Okay, so the gaseous lasers used to be sitting in a sealed glass tube. Of course, that made them very fragile. Now the diode lasers we use as a p-n junction gap. Okay, and that's a lot to explain. You don't need to know in detail, again, because we're not physicists, but it's the positive-negative junction gap. And that's, again, what happens is there are two different semiconductor materials. There's the gap between the two slabs of this material. And between that gap, that is where the laser is going to be created and then emitted. So there's a fully reflective mirror on one end so that all the photons are bounce off that, and a semi-reflective mirror so that that's the end at which the laser will be emitted. Okay, so the gaseous laser looks kind of like this. It's a tube, there's helium and neon in it, there's an energy source, and then the fully reflective mirror, so the photons are going to be bouncing back and forth, and then they get emitted through the semi-reflective mirror. So this is the PN, the diode laser, and the PN junction gap. So at the top here, this area, okay, that would be the P-type material. Here, this would be the N-type material. And so in the space between, that would be the PN junction gap. That is where the photons are going to be traveling back and forth. They're going to fully bounce off this fully reflective surface, and they'll reflect off the semi-reflective surface to a certain point, and then once they get to, there are enough of them, they're going to be emitted through that surface. If you want to see that a little bit more detail, you can go to YouTube. There's lots of videos to show you more about how diode lasers work. Again, you do not need to know that for the course. Okay, and in both of them you see that there's an energy source or a power source. So that's the third component of a laser that's important. And for both the gaseous and the diode lasers, we're using electrical source. And we've seen that before. You know, the first type of energy, electrophysical agents that we were using were purely electrical. When we looked at ultrasound, we saw that it was an electrical source that was being connected to the piezoelectric crystal that made the ultrasound waves or the mechanical waves. Here again, it's an electrical source. This electrical source is being applied to either the gases in the glass sealed tube or the semiconductors in the diode lasers. Okay, so that electrical current passes through the resonance chamber and stimulates the active medium. Okay, and this is just summarizes that for you. Again, here are some of the videos if you'd like to see them. Maybe what we'll look at is this one. Actually, I'm going to leave that and you guys can watch it if you want. You have it in your handout. Now that we'll just summarize a little bit the fundamental properties of light. We've gone over that laser light is monochromatic, so all the photons are traveling at the same wavelength. That it's columnated, so it's a very narrow beam and there's no spread, there's very little spread or divergence. And also that laser light is coherent in that all the photons are traveling in the same direction at the same time. The other thing we just heard was that there are three main components of the laser. Do you remember what those are? There's the active medium, and the active medium resides in the resonance chamber. Okay, and then in order to get everything going, there needs to be a power source in that active medium. Okay, so we're going to have a look at this video just to summarize that. Okay. And of course, this is for a diode laser.
It's a crystal very much like gallium arsenide, a tiny crystal with mirrors front and back, polished or cleaved, so it's a largely reflecting surface on both faces. And you pass a current through the diode. It populates the space inside the junction with electrons and holes. And these recombine and produce light, which is bounced back and forth through between the mirrors, and that inspires more electrons and holes to recombine and singles out, instead of a broad beam of spectrum of light, it concentrates at a single frequency, and all the light comes out in a very intense collimated beam.
All right, so let me find where that is. Let me get back onto here. All right, so that's kind of everything as a summary, and we're going to break that down. So the first thing that we need to do is called pumping of the active medium, and that's basically when the electrical current passes through the resonance chamber and activates the active medium. What does that mean? It means that the atoms within that medium are energized. Again, now what does that mean? That means that the electrons of those atoms move them from their resting ground state, or E0, to an excited state. Okay, and as more and more of the electrical current is passing, there's a growing number of excited atoms in the resonance chamber. Okay, so what do those atoms do? We call it, at a certain point when the majority of atoms have reached their excited state, we call that a population inversion. So there's an inversion of atoms to their excited state, the electrons of those atoms to an excited state. And once they're in that excited state, they don't actually stay excited for the whole time. What happens is there can be a spontaneous drop of an electron from its excited state to its ground state. When that occurs, a photon is produced. Okay, and then as more and more of those electrons are spontaneously dropping from the excited state to back to its ground state, there are more and more photons being emitted. Now, all those photons at this point aren't traveling parallel to the wall, so the ones that aren't are going to be absorbed by the wall. So only those ones that are traveling and being reflected from the mirror surfaces are the ones that are going to continue to travel through. Anything that hits the wall is absorbed. Okay, so we have spontaneous emission, but now those those photons that are being released when the electrons are dropping from their excited state to the ground state, those ones now we call them incident photons, and what they're doing is they're going to strike or run into the electron of an atom that is still in its metastable energy state or still in its excited state. Okay, so that incident photon, okay, will hit that electron back into its resting state, and of course when it's going back into resting state, there's another photon that is emitted, and that photon is identical to the incident photon, the one that hit it. So now the new photon and the incident photon are both traveling together in phase, so at the same time, same direction, at the same wavelength, and they're both traveling inside that resonance chamber. Okay, this process, of course, as you get more photons hitting more electrons, releasing more photons, that is self-perpetuating. And now this is the fifth step of the process of creating a laser, is that there's an amplification. And what that means is that the incident and the newly formed photons that are traveling back and forth inside the resonance laser, those are being reflected between the two mirror surfaces. And that, because there's so many of them, that greatly amplifies the process of stimulated emission. Okay, and that chain reaction creates more and more in the resonance chamber until there's a maximum capacity of that chamber to store the photons, and then they're emitted as a beam of laser light. Okay, and that comes out through that partly or the semi-reflected surface, semi-reflective mirror through that area. And what you see when we turn on a laser, it just takes that that little lapse of time before it's able to emit, and that's just what's happening. Is that just takes that little bit of time for the photons traveling back and forth to get enough of them together so that they can produce that beam of energy. And of course, that beam of laser light has those three properties. So they're monochromatic because all of those photons again are traveling at the same wavelength. They're columnated, so only the ones that are traveling parallel to each other back and forth between the reflective surfaces will be emitted, and they're coherent. They're all traveling in the same direction. Okay, and so what this looks like, so E0 is, so this would be an electron or several electrons within surrounding the atom, and they're at their ground state. Okay, with the when we put the energy source in, what we see is that those electrons come up to an excited state. They're getting really excited. They're have a little bit more energy, but Spontaneous emission then is that they drop back down to their ground state and the photon is emitted. That photon then is traveling in the resonance chamber and it'll hit another or a second or a third electron that is excited and convince that electron to, well, it doesn't convince, it's just that what happens. And another photon will be emitted with that first electron dropping back down to its ground state. So that's stimulated emission as opposed to spontaneous emission. So the incident photon is stimulating the next electron to emit another photon. So now you have two photons. All right. So it's just looking like this, where you have the pumping. So we're pumping energy into the area, exciting the electron. The electron spontaneously emits a photon and drops back down to its resting state. That photon will travel and hit another electron that's excited, and that will stimulate the emission of a second photon. So now those two are traveling back and forth, and then that just occurs with each excited electron that those photons will hit. Okay, so this is what we see here. I'll let you have a look at it. Okay, and then there are enough of them, and then they will be emitted as a beam of laser. Okay. And so then what we see is that there are different wavelengths that are going to be important for us as we're using the laser for therapy. And we call a specific range of wavelengths within that electromagnetic spectrum an optical window. The optical window that is important for us is this window here between 904 and 600 nanometers. Okay, so 904 and 600 nanometers, we call that the therapeutic window. And it's this optical window that triggers a biomodulation in the tissues. And that's the one that we're most interested in. Okay. So again, this is the electromagnetic spectrum, and there are many different optical windows. So this would be the optical window for infrared between 1 millimeter and 1 micrometer of wavelength. And what we see here is this is the same slide you saw before, between 904 and about 630. That is the optical window that we call the therapeutic window. So that's the optical window where electromagnetic energy of electromagnetic spectrum is going to be able to be used for therapeutic purposes. I hope that helps you to understand a little bit more what the acronym LASER means. So again, laser means light amplification for stimulated emission of radiation. So we know how it amplifies, how the photons are being stimulated for emission of other photons, and then how all that comes together to make that laser beam. Okay, so now that you know how it works, how it's created, how it's generated, now we'll see how it works. Okay, so the actual physiologic and therapeutic effects of laser are not terribly well understood, but the consensus is that laser works by photobiomodulation. Okay, and we just saw that in the previous slide. So we'll talk about what is photobiomodulation and what its effects are. And really what happens is that there are photochemical interactions between the photons going into the tissues and the healthy cells that are surrounding the tissue that is affected by the pathology. So when we talk about biomodulation, what does that mean? So biomodulation is the process of modulating, either stimulating or inhibiting the chemical functions of a cell. Okay, so if it's being stimulated, we call that photobiostimulation. Okay, when we talk about photobiostimulation, that's increasing cellular function as a result of laser stimulating the exposed tissue. And we talk about photobioinhibition. So again, the photo is being either stimulated or inhibited by laser. And in this case, photobioinhibition would be decreasing cell function as a result of the laser inhibiting the exposed tissue. Okay, and there's believed to be a dose response in that lower doses of laser energy going into the tissues triggers biostimulation, and higher doses trigger photobioinhibition. So when we're going to be applying the laser to tissues, it's really important that we don't go, that we try to respect the dose level that we want. Okay, and we're going to talk a lot about dose level. There are times when you would want photobioinhibition, and you can think back to what we did around wound healing, and sometimes we want to inhibit growth of, for example, bacteria, but other times when we want to stimulate the function of a cell. And that's how we're mostly going to be using it, especially when we're talking about soft tissue healing. Okay, so when we talked about photochemical reactions that occur, so how do those occur? The first thing is that there's a photonic absorption. So there's absorption of the photons in the exposed soft tissue, and that energy then is transferred between the photons and the photon accepting molecules. And those photon accepting molecules, we call them chromophores. Okay, certain chromophores have a certain wavelength to which they're receptive. The mitochondrial chromatomes, the mitochondrial cytochromes, those are the ones really that we're trying to target with our laser treatments. These are the ones that are most important for photobiomodulation, and these are the ones that are sensitive to photons that are emitted in that therapeutic window between 904 and 600 nanometers. Okay, so the mitochondrial cytochromes are a type of chromophore, and those are the ones that are important for the increasing the cell function that we're looking for. Okay, and that's why it's really important that the laser that we're using is monochromatic. And again, laser is monochromatic, but that's the most important property of light that is being used for photobiomodulation. Okay, and in fact, although laser has 3 different properties, and that's monochromaticity, the collimation, and coherence, monochromaticity really is the only one that is maintained after the laser hits the skin. And that's just because with collimation and coherence, due to the laser scattering as it reaches the different layers of tissues, we lose those 2 properties. Okay, so what do we use for? So laser is used therapeutically by us for pain management, for open wound healing, and for soft tissue healing. Okay, and how it works is, again, it triggers chromophore activity, which in turn activates cell metabolism, and that leads to optimal cell function. Okay, and again, it leads to analgesia for pain management, anti-inflammatory effects for soft tissue healing, and also healing of wounds. Okay, so it's not known exactly how that occurs, but what we do know is that there's a promotion of ATP production in those mitochondria. Also, the fibroblasts promote collagen production. There's a modulation of inflammation, and we can also use it to inhibit bacterial growth. Okay, the clinical indications, so in other words, why are we using, or what are the clinical conditions that we would use low-level light therapy for, would be in particular soft tissue, and that's really what we're going to use it a lot for. It can also be used for bone healing, so things like lateral epicondylitis, lots of different tendinopathies, cervical pain, shoulder impingement, adhesive capsulitis. So it's found to be quite effective for that. It can also be used for wound management, including possibly for pressure ulcers, and it's actually some of the recommendations are around rheumatoid arthritis, and it should be used when somebody has rheumatoid arthritis of superficial joints. It can also be used for osteoarthritis and for joint pain management. And we'll also use it for pain management, so of various etiologies, so neck pain, other musculoskeletal pain. It can be used for meniscal tears, although there's not terribly strong evidence for that. Okay, and here there are some other, so there's some quotes from the literature about joint pain, rheumatoid arthritis, pressure ulcers. You do have the references for those at the end of the PowerPoint presentation. Okay, all right. So if we take a flowchart from it, we know that low-level therapy produces electromagnetic energy. That light energy is going to be either in the visible red range, so more in the 600 nanometer range, or to near infrared, so 904. And again, we call that the therapeutic window. And what happens then is that light energy penetrates the tissues, it activates the chromophores. That activation of the chromophore increases mitochondrial metabolism, increases cell metabolism, and what that produces is photobiomodulation. That photobiomodulation then can lead to analgesia or an anti-inflammatory effect. And these will happen by increasing collagen and protein synthesis and enhancing cell metabolism and function. And what we get is pain management, we get management of tendinopathies, and we can help us manage wounds. So now that we know what laser is, how it's generated, how the effect that it has in the tissues, and the reasons, the goals, the clinical goals that we're going to use it, now it's time to talk about how we're going to actually use this. So what are the settings that we're going to use on the machine? What type of laser are we going to use? So the choices that we make are going to depend on these specific parameters. So the wavelength, the power and the power density, the energy and the energy density, and the dose. And we talk about dose per point and post per treatment. And time is factored into all this, and they're all interrelated, and you'll see that. Okay. So if we talk about the wavelength, so wavelength will have an effect on the penetration depth. When we talk about that, we're looking at two main factors, absorption and scattering. So the greater the absorption of the energy superficially, the less deep the laser is able to penetrate. So when it's absorbed particularly in the skin tissues, superficially, not much of it is able to go into the deeper tissues. And what we see is that red light is absorbed more by the superficial tissues than infrared light. Okay, and remember, again, that we're talking about the spectrum, that therapeutic window, where red light is actually in the visible spectrum, and some of the other lasers, and we'll talk about the specific wavelengths in just a moment, are in that infrared spectrum. So red light absorbed more superficially, and then scattering. And scattering just means that how much that beam is going to be scattered into different areas. And what we see is also that lasers that are in that red, that visible range, scatter more than lasers with longer wavelength. So that means that, again, because of scattering, infrared light penetrates more deeply than red light lasers for those two reasons. Remember that the infrared goes deeper and the red light is more superficial. And what that means is that red light is in the 630 nanometer range, and that goes really quite superficial, and that's actually in the range of about half a centimeter deep, whereas the infrared laser, which is around 900 nanometers, can actually go deeper, and we say about 2 to 4 centimeters. Okay, but as you can see, even though it penetrates deeper, there is still some scattering that occurs even with the infrared laser. If we talk about power, and we know that power is measured in watts, and it's basically is energy per second. So it's how much energy in a given amount of time. So we measure it in watts, and in fact, for laser, we've said that the class 3B lasers that we're using are between 5 and 500 milliwatts. So this is what we're talking about here in the region of milliwatts. And we're looking at really quite small amounts of joules, so 0.01 joule per second if it's 1 milliwatt. So of course, if we're using, for example, a 100 milliwatt laser with a power of 100 milliwatts, then we would be looking at 0.1 joules per second, so the greater the power of that laser beam that is produced, the faster we're going to be able to get energy into the tissues. Okay, and then so just the only difference between power and power density is just if we're thinking about that power being delivered over a certain amount of space. And we usually, for as physiotechnologists, we're talking about usually a centimeter squared, so over a given amount of centimeters squared. Okay. When we talk about energy, so energy is different than power because power is the energy per second, but here we're really just talking about just the energy. So that's measured in joules. And how we get that is we look at the power and we times it by the time. So if we have a 1 milliwatt laser and we're putting it on for 10 seconds, now we're going to be looking at 0.01 joules per second. Okay, so energy density, the same thing, is just the amount of energy being delivered over a centimeter squared. Okay, and that's actually the preferred clinical measure that we want to use when we're talking about delivering energy into the tissues. Okay, and so we're looking at how much is the dose. So the dose is the amount of energy delivered by each diode when we're talking about is per point. Okay, again, it's energy, and energy is measured in joules. So it's the power times the time by each diode. Okay, and this just corresponds to the dose per point of application, because you'll have to put each point of application, and you'll see this in the lab. You put that one point, then you take the laser off and you put another point. Again, we'll see that in the lab. Okay, and then if we want to do dose per treatment, we're just going to add however many points we did in a treatment session. So if you're delivering 2 joules and 2 joules and 2 joules, and you're doing it over 3 different points, it's just going to be simply the dose per point times the number of points. Okay, so then that gives you the total dose that you've given for the treatment. Okay, so if we look at an example of this, so say somebody's coming in, for lateral epicondylitis, and you've decided that you're going to treat them with laser. Okay, the type of laser, for example, the one that we have at Dawson is a single diode. We've got the probe is just handheld. There are some that can be kind of on a sweep. We don't get into that here. The power of the laser in this example is going to be 20 milliwatts, and the wavelength is 820 nanometers. So we know that that's deeper than the infrared, okay, but it's not quite as deep as a 900 nanometer laser beam, but it's still, we're going to say probably around maybe 1.5 to 2 centimeters deep. Okay, so again, if we're thinking about below the surface of the skin, trying to get into that, the attachment of the wrist extensors for lateral epicondylitis. Okay, the diode beam area, that's set on the probe, and that's just the area where the beam is going to come out of. So when we're looking at how it was created, that's the surface, that semi-reflective surface that allows the beam to escape. Okay, so these are all going to be set depending on the type of probe that you choose and the wavelength that you choose. Okay, and that wavelength will be decided by the type of laser that it is. Okay, so this is what we've decided. So now we want to see how much energy are we going to put into our patient's lateral epicondyle, or towards the tissue covering the lateral epicondyle. So we're looking at what is the power density, right? So that's the power per area. So what I'd like you guys now to do is take some time and work through it. Okay, so pause the video here, take your time, work through it, go back through the slides that we've just done and see if you can find the answers. So I hope you took some time and you went through that calculation on your own. We'll just go through it briefly here, but this is definitely something that we will do in the lab, in the next lab that we have together. Okay, so so these are the equations that you should have been using. And what we see then is the power of the laser is 20 milliwatts. So the power density then, because the diode area is only 0.5 centimeter, so over that centimeter, the power density would be 40 milliwatts per centimeter squared. Okay, And what that means is 40 millijoules per second in each of those centimeters squared. Okay, that's just another way to restate the power density. So if we want to get what the energy density is, then we've got this 40 millijoules per second for each centimeter squared, and we times that by the time. So if the laser is on for 2 minutes or 120 seconds, what we get then is 4,800 millijoules per centimeter squared. Or if we just put the decimal, change the decimal, then we have 4.8 joules per centimeter squared. But now remember that the diode area is only 0.5 centimeters squared. So per point, then it would be 2.4 joules for each time that we're applying it. So for each point, but there are 2 points of 0.5 centimeters squared. So the treatment dose then is going to be 4.8 joules for that treatment. So 2 points of 2.4 joules. All right, and that what we see, that's exactly the example that you have here, and this is taken from your text. So you should be able to find it there. The table number will be a bit different because it's a different edition. All right, so how do we decide? So here we decided that we were going to use 20, with our 20 milliwatt laser, we were going to use it for 2 minutes. How do we decide that that's what we're going to do? So there are two ways. What has been developed is there is a World Association for Laser Therapy, and they have come out with some guidelines. And you have that here, you have it in the references if you do want to go and have a look at it. Again, we are going to be using some of those references when we go over this in the lab. And what it is then, they've come out with a couple of tables of recommended treatment doses for different diagnoses, in particular for different types of tendonitis and different types of different types of arthritis. So if we look at the 904 nanometers, so the gallium arsenium lasers, their general recommendations is that the laser should be applied for between 30 seconds and 5 minutes with a minimum dose per point of 1 joule and a maximum power density of 100 milliwatts per centimeter squared for each point. Okay, and again, we will go over what that means in a little bit now, and we'll do more of it in the lab. Okay, for the gallium aluminum arsenide lasers, again between 5 and 500 milliwatts, and they can use it pulsed. They suggest using it pulsed or continuous. And again, the radiation times should be between 20 and 300 seconds, with a minimum point density of 4 joules and a maximum power density of 100 milliwatts per centimeter squared for each point. Okay, so the difference here is that the deeper the joules that are going deeper, minimum of 1 joule, whereas for the little bit more superficial lasers, minimum of up to 4 joules. All right. The other daily treatment is, the other recommendations is that they recommend daily treatment, so 5 days a week for 2 weeks. Or if you can't quite make that, that frequency, every other day for 3 to 4 weeks is what is recommended. And that's definitely something that you see in the literature. That's how all the studies are being looked at. Okay. The irradiation, so the beam should cover most of the pathological tissue in the tendon or in the synovia when you're using it either for an arthritis or for arthritis in the case of the synovia or for the tendonitis. Okay. And what they recommend doing is start with the energy dose that's in the table, but then as the inflammation is under control, as the healing continues, you can actually start to reduce it by about 30% once it's under control. Okay. And again, laser will be affected by so laser is a light beam, and when it's passing through different tissues, and when it's passing through different things in the tissues, it may not pass as well. We all know that some skins will block the light more. So if you're treating somebody that has white or Caucasian skin types, you can use those recommendations. But somebody who has more melanin in their skin, what you may find is what is recommended is that the dose is actually increased. Okay. Uh, Another way that so this is talking about, Wald very much talks about how many joules, should be delivered for a specific diagnosis. But there are other suggestions for a wider range of pathologies. And then these that tend to be based on joules per centimeter squared, which of course is, think about it, is it the power or the energy density? Okay, because it's a joule, it is the energy density. Okay, so for soft tissue healing, for fracture healing, for arthritis, acute and chronic, we would also, as physiotechnologists, you guys would be using it for acute and chronic soft tissue inflammation. So these are things that you would have on hand. You'll have tables on hand to decide how you want to use it. Okay. And we've just gone over treatment frequency. So how often should they receive low-level laser therapy? The recommendation was every day. Okay. 5 days per week from the majority of studies cited. If it's not possible, they could go to 3 times per week, and it should be 2 to 3 2 to 3 weeks is the recommended amount of time. But if it's only 3 times per week, then 3 to 4 weeks is recommended. Okay. And now we'll get into application methods, and we're going to do more of that in the lab. Okay, so application methods, again, we'll do this in the lab. 2 different types, point by point or scanning. So point by point, and that's what we're going to use in the lab, is it uses a single diode probe over the target tissue. So you're right over the target tissue. And that single laser is going to make a contact with one point on the skin. So it's not moving, it's just static. Okay? The probe is moved from one point to the next after the dose is delivered. So you'll put it on one point until the dose is delivered. Then you can pick it up and put it to another place while the next dose is being delivered. And those points should be enough that it covers the entire target area. Okay? So I've just been describing the contact area. If it's quite sore, or if you're talking about a wound that you don't want to be making contact with the metal of the probe, you can do it non-contact, so it's held just above. Another way is to make a grid, so really to kind of be going over it as a grid. There are probes that do automatic scanning, and in this case the probe is scanned up and down or side to side over the treatment area, and the dose is being delivered while the scanning is happening. Okay, so point by point, you're manually going to different points on your own, whereas scanning the probe, and often it's a cluster probe, will be scanning up and down and side to side over the treatment area, often is automatic. Okay. And you can see here, this is very similar to, it's similar to what we have, where it's going to be just in the one point. Here also it's just in the one point. This is a little bit larger. This is probably a cluster electrode with several different diodes in it. Often you'll see the red light, but that doesn't necessarily mean that it's in the infrared, it's in the visible zone, in the red zone. Sometimes what manufacturers will do, they'll put a light in there so that you can see what you're doing. All right. So the contraindications, not exactly the same as for ultrasound or for electrotherapy. So certainly there are areas that you don't want to put light energy or laser energy into. Any area that's hemorrhagic, you don't want to use it with epileptic patients, or within 4 to 6 months after radiotherapy. So radiotherapy is when people are getting large amounts of radiation in order to treat a cancer. So they have a lot of buildup of radiation within their body. So within 4 to 6 months after radiotherapy, you would choose something other than laser. The precautions though, and you see them here, over photosensitive skin areas. So that's something that really you do need to ask your patient. In particular, it's not something that shows up on the medical record usually. So ask them if they have photosensitive skin, and if they do, then this would not be the right choice for them, or you would use it with a precaution. You might start with it. Again, over a bruised muscle, a bruise is basically hemorrhage within the muscle. that's still healing, or with impaired sensation. So those are just precautions. Okay. But there are some adverse effects that can occur. So of course, as we discussed before, you should not be exposing the eyes to laser. And we'll see in the lab again, they're not regular sunglasses, but they are certain type of lens that filters out particularly the wavelength of the laser. So it's important that you match the laser with the eyewear. So that's something to keep in mind in the lab. When you're working in a clinic, you will have a choice of one or two lasers. So the glasses that go with it are it's a little bit easier to pick out. Okay. Some of the other adverse effects that have been reported are transient tingling, sometimes a rash, mild redness, occasionally burning sensation, occasionally pain and numbness, and from a warm diode. Again, that would be the shorter wavelengths. So the longer wavelengths. So the red ones that penetrate less deeply. Okay. If you do want to see other references, they're all here. Again, electrotherapy.org has some great literature there. Electrologique is from Université Montréal, and again, these are all just ways to see. It's the same information. It's presented a little bit differently. If you have any trouble understanding, sometimes they're really good things to go to. Okay, and then further reading. This is where the information on the different pathologies, on the different clinical applications that you can see. So keep this when you're out there working in the field. You can come back to this and you can get some more information if you need it. All right. So that's it for now. What